Well, I think that Waldenström has been at the forefront of malignant hematology in terms of the importance of genetic characterization. It was one of the rare diseases in which a true highly recurrent somatic mutation was described, MYD88, and the second one that is relatively frequent, CXCR4, and since that moment where truly diagnostic changes in this disease we are seeing as new drugs emerge and have been approved and implemented in the treatment of these patients, how genetic testing can identify those that will have different survival according to different types of treatment, immunochemotherapy, BTK inhibitors, etc. And I think that in this meeting there were important data being shown highlighting that genetic testing should include obviously MYD88, CXCR4, but also other key alterations such as deletion of 6q and eventually alterations in TP53.